When living with chronic pain, it can be really hard to want to move your body. Oftentimes, movement causes more pain or causes discomfort, and that generally doesn't feel good. It doesn't make you want to move more and cause more pain. But movement is actually really important and really good when living with chronic pain. And today I'm going to discuss 5 different reasons why that is the case. I'm Audriana. I am a physiotherapist and trauma-informed yoga instructor, and I am very passionate about chronic pain. So let's dive into these reasons why it's important to move when living with chronic pain. The first reason that it's important to continue to move your body when living with chronic pain is because movement builds muscular strength. And if we have more strength, our body is better at supporting us in general. If our muscles are stronger, if our leg muscles are stronger, it's a lot easier for those muscles to help us walk and help us move about our day. If our arm muscles are stronger, it's a lot easier for those muscles to pick things up, lift them up off the ground or off of a shelf. And so movement, strength training can be really helpful to build up this muscular strength, and that in turn can help to decrease pain in general when the muscles are stronger. Another reason movement is really important for chronic pain is it is actually shown to help improve sleep. And I know you're probably thinking, what does sleep have to do with movement and with pain? But when living with chronic pain, it can be really hard to sleep. Oftentimes, lying in bed, you can feel a lot of pain and go through a cycle of having poor sleep because you have a lot of pain, and having a lot of pain, which makes it really hard to sleep. And so movement has been shown to help sleep. Movement often releases endorphins and can actually help calm the body overall, which can help you drift into sleep sooner than you might if you didn't move your body. Now, a caveat to this is that it is best to not do really heavy movement or high intensity movements, especially right before bedtime. Doing that before bed can cause that kind of adrenaline rush and can make it harder to fall asleep. So if you are moving your body, it's best to do this a few hours before going to bed for optimal sleep improvements. The third reason why movement is great for chronic pain is that it improves flexibility and mobility of the body. Now, very similar to improving strength, if we have more flexibility and more mobility in our body, it is often easier for our body to perform certain movements. And so if we have more mobility, it can be easier to reach, it can be easier to bend, it can be easier to grab. You get the picture. So improving flexibility and improving mobility through movement can in turn help reduce pain, because if our body is moving in those ways that it's meant to move, that flexibility and that mobility is increased, it understands that it's okay to be moving in those ways, and it can help reduce our pain. The fourth reason why movement is good for chronic pain is because it actually reduces pain sensitivity. Oftentimes, you don't want to move when you're in pain. Like I mentioned, it is painful. It doesn't feel good. So when living with chronic pain, in order to move the body, we have to help the body to recognize that it is safe to move. It is okay to move. We are not damaging anything further by going on a 5 or 10 minute walk. The body just becomes more sensitive and feels like that isn't safe and produces those pain signals. And so if you actually gradually introduce movements really slowly over time, you could start with a 2-minute walk, then a 4-minute walk, then a 6-minute walk, moving really slowly and really gradually over a period of weeks. That can help the brain and the body connect and understand that this movement is not actually harming me. And that can help reduce that pain sensitivity threshold, helping pain overall. The final reason why movement is great for chronic pain is because of its mental health benefits. Oftentimes, movement is really good for feelings of anxiety and for feelings of depression. It can help decrease these feelings, and it can also improve mood overall. The hardest part is really getting going. Living with pain, it can be hard to get going with movement. So I invite you to start really slow and start really small. Like I mentioned, a 1-minute walk, a 2-minute walk, a 5-minute walk. Really gentle stretches sitting on a couch or lying in bed even. I have a few videos on my channel you can check out that are good for chronic pain, really gentle movements. Even if you can't do the whole thing, just starting with 2 or 3 minutes is enough. Gradually over time, if you go slow and steady, your body starts to recognize that these movements are safe, and you can increase the ability of the body to move over time. I hope these tips were really helpful for you, and I hope that it makes you more confident to feel safe moving your body when living with chronic pain. Feel free to comment below your favorite movement practices that you find helpful for your pain. I also have a course, Chronic Pain 101, Learn to Understand and Transform Your Pain Experience. I will link this in the description below. This course discusses what chronic pain is, what impacts chronic pain, and different tools and strategies you can use to help your chronic pain experience. It also has a variety of meditations and gentle movement practices in the course. I think it will be really helpful for people living with chronic pain. I'll see you next time.